My name's Alfred Wong. I'll introduce myself in just a moment, but I wanted to first characterize why we came up with this webinar. Um, if some of you recall, last November, I had the pleasure of hosting Dr. Laura Hume and Ashley Rahiman here at the office, and we had a conversation at that time about them wanting to plan opening up a medical clinic. And we're now a year later, and I'm really excited to bring Ashley back to share her story. Um, oh, sorry, Ashley, did you have something to say? Oh, no, you weren't waving at me, right?
Oh no, sorry, just
Okay,
waving to the
no
doctor.
problem. Yeah, so we're now a year later. Very super excited to bring Ashley back and share her story of how she got MD for Me up and running, and more importantly, how she's been able to run a nine-doctor clinic with only two administrative staff. Um, so without further ado, about me, I'm the Chief Operations Officer here at Cortico. For some of you, we may have corresponded. I'd love to get have a follow-up conversation with each of and every one of you to figure out how we could help resolve some of your challenges at your clinic. But today, the star of the show is, of course, Ashley Rahiman. We also have Matt Senior from the Cortico team. He's our sales engineer, and he'll be responsible for answering some of the questions that we have in chat. Both Ashley and I will try to answer any questions that come through, but just in case we don't answer any questions in time, then we'll definitely follow up one-on-one with each and every one of you. Ashley, why don't you give us a quick background of who you are, what MD for Me is.
Yeah, for sure. So I'm Ashley. I am a recent clinic owner. I've also assisted in opening up many clinics in BC. Just and sorry, my clinics are wrapping up right now. So yeah, opened up many clinics. Assisted in operations management, recruiting doctors, consulting medical supplies. That's pretty much it. And then just slightly after the pandemic, I did join Cortico and to help a lot of traditional practices teach them how to adopt smart technology into their clinics. So been doing that for the last little while. And then just this last year, I planned to open a traditional family practice with a slight touch of modernization in Vancouver with my business partner, Dr. Laura Hugh. But yes, that's pretty much it.
Awesome. Thank you, Ashley.
No
So
problem.
just kind of going to our agenda today, we do have 45 minutes. We wanted to have an opportunity to drill into Ashley's brain a bit in her operations, but also give some time for the group here to ask any questions. And like I was sharing earlier, if there's any questions that we are unable to answer in the short time frame that we have, Matt and myself will be more than happy to have that one-on-one conversation with you. So the first, just really simple, we wanted to ask Ashley what her principles were in running and starting and running her clinic, and then also figuring out what some of the outcomes were in the year or so that MD4Me has been in operation. And finally, we want to talk about some of the um, things of success that Ashley and Dr. Laura Hume have implemented at their practice. And of course, any other questions that you may have. And so, starting with that, Ashley, I wanted to get a sense from you. Um, Now that you've opened MD4Me and operated for a bit of time now, uh, how are things going? What were some of the things that you were expecting to face challenges on, and what reality has that happened for you?
Great question, Alfred. I would say within like my career for the last like 13 years, assisting and helping a lot of doctors open up their own clinics. Again, like it was quite the journey opening MD for me, but I wanted to learn from my mistakes and to not apply it to this journey of mine with Dr. Hume opening MD for me because I had a different vision. I know that healthcare is really different right now, especially family doctors, the shortage of family doctors, shortage of doctors accepting patients. What I wanted to do was I wanted to start a clinic where I can bring in family doctors, I can implement an organized workflow for them. I wanted to clean their current panel up so they can accept more patients. So I wanted to do things differently. I wanted to protect our traditional family doctors by also implementing a positive solution of modern technology so our doctors don't feel burnt out, our staff don't feel burnt out. So yeah, the journey was wild. It was really, really wild. I haven't opened a clinic since the pandemic, so I wouldn't say it was super, super challenging for me, but a lot of research, again, finding the right location, bringing in the right staff member, bringing in, good, great doctors who are ready to, help our community, especially because in this area in Vancouver, there is a lot of patients or without a family doctor. So I wanted to start something. I had a different vision this time, but I wanted to do things correctly by learning from my mistakes, but also bringing in a great team to provide proper care for our community. So again, it was challenging. A few hiccups here and there, but again, like we opened January 8th and it's October now. We got about 9 doctors now and just 2 office administrators running the practice. So
So
yeah.
I'm really curious about that
Mhm.
because in a lot of conversations that I have with medical clinic practices, usually it's one MOA to one doctor, and sometimes maybe one MOA for every 2 doctors, but you have 9 doctors and 2 administrators. How does that
Mhm.
work? Like, are you overworking your MOAs?
Yeah, they're working right now. Just joking. Um, that's a really great question. So, you know, I wanted to do things when I say I wanted to add a touch of modernization. The touch of modernization is implementing a smart patient engagement platform in my practice. And of course, I use Cortico. And again, like I got 95% of our patients are booking online. 5% are learning to book online, but we've made it so user friendly for them that my oldest patient is 98 years old and she books her appointments online herself. So again, if there is issues with technology with certain patients, I want to be able to educate them. I'll just bring my tablet out and I'll sit with them in the waiting room just to show them how they can book online if they want to try. No one is pressured to use technology in our clinic. We still pick up our phones. We respond to all our emails. And again, like, having our clinic open, proper business hours. And we do have senior patients that do come in that want to still book their patient or their appointments in person, and they're more than welcome to. But yeah, educating our patients on how to access care in our facility, it has reduced our administration tasks by a very large percentage. I want to kind of give you a scenario. So Dr. Hume, she is my business partner with an MD for me, but she had a current panel of about, I would say, 1,200 patients. So in December, before we opened in January, I cleaned out her panel. So we basically had to not terminate or let go, but we had to flush out patients that haven't followed her in years. So we ended up reducing it by, I would say, 950 to 1,000 patients. And that opened up, doors for her to accept close to about 300 patients. So, opening a clinic, during, inflation, I had that fear of, you know, what if I don't have enough doctors? What if I can't afford my rent? Like, what if I can't afford any of my bills, working with one doctor, one office manager at the time, and myself? Like, it was challenging for the first month, but after cleaning her panel and accepting new patients, the word spread within our community that, hey, MD for me is accepting new patients, which resulted in patients leaving reviews, maybe contacting Doctors ABC, contacting our local division of Vancouver. And that naturally, organically attracted new providers to join our practice and to be accepting patients. So, um, But yeah. So again, challenging, but I mean, I
Mhm.
feel like we now have the grasp of things and establishing organized workflows, in our clinic, and mostly focused on our patient feedback. So any patient that leaves our clinic after seeing a doctor, we love asking for their feedback. How did they like the online booking? Was it user friendly? And the great thing is I can take that feedback and bring it to Cortico and let them know, right? So again, we're not just, it's not like a patient can just come in, get their refill and head out. We love hearing patient feedback, which is super important for MD for me
Mhm.
and our doctors.
Ashley, could you touch upon some of the things that in your experience working and consulting and advising other clinics, what your administrative staff are doing differently that
Mhm.
it allows them to work efficiently? And I'm assuming that you're not working them until like, 8 p.m., right? Like they actually have the time to go home. So how would you characterize what you've put in place in terms of your operations and workflows?
Okay, so weekly, I mean, this could be a whole new webinar, but I'll just kind of shed some light on what we do daily. So our clinic opens, our patients come in at 9, our operations is 9 to 5, but my staff comes in around 8:50 to 8:30. In that time, we have our morning huddles. Our team meetings with myself and my office administrators are super, super, again, useful. It's kind of, they feel more relaxed before they start their day because in that time we can review the schedule, see what kind of complex patients are coming in, making sure that we have pertaining information attached to the patient's documents so that doctor has information on that patient when they do see that patient. Because 9 out of 10 times, sometimes, blood work, doesn't come through Acceleris. Sometimes we don't have radiology results that come through faxes and sometimes they're late and we do have these pre-booked appointments. So we want to make sure that we take our morning huddles really seriously and to make sure that we review each schedule for all those providers that are working that day just to make sure that it's nicely organized. Um, uh, so that reduces our wait time. Like I don't have a wait time. I have 14 waiting room chairs and I only have 1 to 2 patients in those chairs because again, I have no wait times. Patients come in, patients leave just because of, being organized and having those huddles in the morning. Another thing, what I've also implemented is, talking with my providers, my doctors, and seeing, what their workload looks like, and what would be a healthy workload, what would get them home on time for dinner, what would make them not bring work home. So what I've also implemented is I have 6 exam rooms, 9 doctors. So how that works is I can have about 4 to 5, close to like maybe 10 doctors at a time. And how I do that is because I do have 3 to 4 doctors working a day. And then I also have about 3 to 4 working from home remotely. Um, on a day like today, I had Dr. Hume, Dr. Adam Payne, Dr. Sarah Golob, and Dr. Simon Leong working today. I had 2 doctors working virtually, and I had 2 doctors working in clinic. And the way that it worked is 9 o'clock, between 9 to 10 o'clock, both doctors have 9 to 10. They see their patients through a phone call. So they'll do virtual appointments between 9 to 10. So, and then just before lunch, they have 2 to 3 more virtual visits. That virtual visits could be quick prescription refills, review of labs, because I find that if you add virtual appointments before lunch, the doctor gets that 1 hour of their lunch that they're going to make. Because I used to work with a bunch of doctors that were going over and working over their, sorry guys, they were working over their lunches. They didn't get a proper lunch break. So 12 to 1, they get a digital detox break and they also get lunch. They get to eat. So I find that having those virtual visits first thing in the morning for the doctors that are working in clinic, it's super helpful because I still have my MOAs that are doing other work. They're prepping the rooms, they're prepping for all the procedures that are coming in, prepping in for the PAPs that are coming in, making sure that we have enough speculums, making sure we have IUD removal kits. Everything is ready to go when those patients start coming in clinic. So, adding virtual visits to your day, it goes a long way, a very, very long way.
That's really interesting. I wanted to drill down on something that you just said, where you're describing how your MOAs were like doing a lot of in-clinic tasks, which they should be. And from other conversations that I have, MOAs are typically bogged down with trying to handle ticklers and fill out forms, calling patients for scheduling appointments, and with only two administrative staff, how does that work? Like, are your doctors also being partially doing that work?
Well, that's the secret. That's the secret. So the secret is we don't we have about, I would say, the only time a provider in this clinic would send a tickler is if they need some scheduling changes. So all our doctors here, by the use of Cortico, I mean, I don't know if I can show you what our instant messaging feature looks like here at MD for me, but let's just say come in Monday morning and you have a bunch of abnormal results sitting in your inbox. Now, 9 out of 10 times, what doctors do is they open that lab, they review it, they create a tickler for the MOA to follow up with the patient to book an appointment. I've reduced all of those steps and clicks. So what my providers and doctors, what they do here is when they do their when they go through their labs, they're not sending any ticklers to our office administrators. They're actually sending follow-ups by 2 clicks on their own. And that is the use of our instant messaging feature that we have implemented at Cortico, which is a simple plugin that can be visible in your inbox section. And again, they open up an abnormal, say, INR results. And, again, instead of sending a tickler to the MOA saying, hey, this patient's INR is this, they need to up their warfarin by this. What the doctors here are doing is they open that abnormal result, type in their message, and it goes directly to the patient's email. Now, it's PIPA compliant, so they do have some security questions before they open up that message that is sent from the doctor. But yeah, so right now, again, a lot of doctors that I always speak to, they're always afraid that patients are wanting to they're scared that patients might respond to that message. So the great thing about that plugin is it's one way, or it could be 2 ways. So it really depends. But again, our providers are doing, when they go through their labs and their consults, it's all the follow-ups are done by the doctors. And again, the great thing about LFP, and I know there's a lot of Ontario attendees here, but in BC, our family doctors, majority of our family doctors have enrolled in the LFP program where they do get compensated for indirect care. So again, they actually get paid to send tasks to their patients on their own instead of tasking it to the MOAs.
I wanted to ask, kind of going back to the start of your clinic operations, how did you hire so many doctors so fast? And when you were hiring those doctors, they knew that this was a fresh new clinic. They must have had some concerns about how they were going to be supported. What were some of those fears? And now, 10 months later, what are their thoughts now?
The great thing is the first provider that joined our clinic, Dr. Liang, he ended up joining us as a locum doctor for Dr. Hume. And his concerns were he had to room his own patients in some clinics in BC. Anytime that he would see a patient, and there's not pertaining documents that are attached to the patient's part, right? So that doubled his workload. His wait time was 30, 40 to an hour wait sometimes in some clinics. So organizational behavior was super important to him, and that's something that we religiously practice at our clinic is organization, and preparation. Preparation, I mean, what patient doesn't want that? One patient doesn't want to be followed up with, a lot of these patients, they take time out of their day, right? Um, and work, especially to see their doctors. And if they come into the clinic and there's not pertaining information that's attached to the chart, then that patient's going to feel overwhelmed, stressed, and again, like ticked off at the end of the day. And that's going to add more to the doctor's burnout. So, what we've done here is every single doctor is heard here. And I find that, a lot of these companies and clinics that open, they don't really communicate anymore. They don't talk to their doctors at the end of the day because everyone's texting and everything's on social media. So what we do here is, I want to make sure that all my doctors here are heard, even if they have full access to me so they can message me, call me anytime. We do have monthly huddles with our twice a month, we'll have monthly huddles with all our providers. Um, and yeah, like again, everybody's concerns are heard. And I just want to make sure that bringing in these providers here that I'm not continuing this whole burnout crisis. I'm not adding to that burnout crisis. So here, again, we reduce burnout. Nobody takes their laptops home, nobody works from home. Everything is done in clinic and the doctors are gone. As you can tell, it's quiet now. So everybody's gone now and it's 10 to 5. So um, yeah, we just want to make sure that everything is organized for all the doctors. Pertaining information is attached to the chart. And then also squeezing in those digital detox breaks throughout their day so they don't feel overwhelmed. So, but yeah,
I see.
organizational behavior.
That's really cool. There's a whole bunch of questions that came in, and I'll find an opportunity to ask you those questions. But I wanted to ask you a question that was actually raised last year in our webinar. I don't think we had an opportunity to address it at the Q&A section, but it was a question that for managers and MOAs, what are the resources to implement a workflow for multifamily physician office with multiple MOAs? And I wanted to bring that question up again because you're definitely in that category. You have multi-family physicians there, and you have multiple MOAs.
Um, I, before a doctor joins our clinic, I want to understand what their current workflow looks like. Um, what are some of their pain points? Because I don't want to continue that when they're joining my clinic at the end of the day. So understand and none of my providers, like some providers, some days they see patients for miscellaneous reasons throughout the day, but our workflow, our day to day is organized where I don't need one MOA per doctor. Um, everything is structured here. I can talk for hours about how we have our workflow structured here. Um, but implementing online booking and having patients choose the correct appointment type when they're booking their appointment, that gets slotted to a day that, for example, Women Wellness Wednesdays, that appointment gets booked for Wednesday. So I would say having an organized workflow, implementing smart technology in our clinic. We are actually introducing Wave the Wait at our clinic. It's a product that leaders. It's an AI triaging system for our inbox. So my office administrators never have to link a single document ever again. Things get automatically linked to the correct doctor by smart technology, AI.
I see.
So that's something that I'm going to be implementing soon in my clinic. And again, we can't live without online booking, or else I'm going to have like 400 or 500 phone calls coming in every single morning. I'm going to have my waiting room is going to be chaotic. So, implementing online booking, or specialist booking. If there's some specialists here today, we do use the specialist booking feature here for one of our providers. But yeah, implementing smart technology in your clinic does reduce admin tasks. And that's why I don't need to hire more staff. I just need two.
So a question came up from one of our guests, from Christy. Um, and it's sort of interesting because in your experience with MD4Me, your providers have experienced less burnout. And they feel that they don't want to bring that they don't have to necessarily need to bring their work home with them. With Chrissy's question is that with all this additional, I guess, tasks that were traditionally the responsibility of the MOA to handle the ticklers, and now that the doctor's doing it, is that potentially not add additional workload on the physician's behalf?
No. You know why? Because you're clicking more to create when you open up your lab and it's an abnormal lab, the doctor is reviewing the lab, then opening up, sending a tickler, typing out the message, and sending it off to the MOA. Now, a lot of doctors that I do talk to that I have opened up clinics in the past, they kept pestering MOAs throughout the day, making sure that urgent tickler was taken care of. So here, what they do is after going and reviewing their labs, they click that instant messaging. It automatically populates the patient's information, in email address, contact information, and they can either type a custom message to the patient, including the booking link to book their follow-up appointment, or what they do is they have canned responses within the plugin that they can create. So if it's an internist that has a bunch of INR patients and they find themselves sending the same type of follow-up messages, great thing about our system is we can create canned response templates, including the booking link, where you open up the abnormal lab, it populate the plugin, click send. That is it. So it's more work creating a tickler and sending it to your MOA opposed to the doctors here sending those follow-up appointments by themselves
I
using,
see.
again, a patient engagement platform.
I guess in some sense, no, I'm not a doctor and I'm not a medical office assistant by any means, but just drawing upon my own personal experience, I can certainly understand how it could be a burden on a provider's um, mind if they're constantly having to remember to remind the MOA if they follow up on a certain urgent tickler, and possibly with seeing so many patients throughout the day, it builds, and that adds to the stress. And I guess what I'm hearing from you, Ashley, is that when the doctor can deal with it at that point in time, then it's basically out of their
It's
memory.
done,
Like
and
it's
they
done.
know it's done. And the great thing is this the patient portal has read receipts. So that doctor can by one click open up the portal and see if that email was open or if that patient has booked a follow-up appointment. Or what they could do is when they do send those messages and if they, want to see if they've booked, in Oscar on the top in the edit appointment types, it does state that, hey, so and so has a next appointment on this day. So having the doctors do it, they give them themselves that reassurance that okay, I have sent a message. But like I said, I mean, not every single doctor is going to do that or implement that. But if it's something that they want to test it out. I'd love to hear their feedback as well. But those canned responses are no joke. So we use those canned responses here. I've created probably 15 canned responses for all our providers, and they're all used pretty religiously.
Awesome. I want to just switch gears for a bit and talk
Yeah.
about patient access, because in one of the outcomes and findings that you provided, and you sort of alluded to it before, where with Dr. Whom you had additional capacity to take on 300 additional patients in her panel.
Yeah.
So just to get a sense of like what how would you see with MD4Me um, improving patient access to care? Is it on the transparency of the process? Is it on the speed of getting an appointment? And sort of wanted to hear from you, like, how would you characterize patient access to care?
Um, Yeah, I have a few things implemented, but I would say the most important thing is to, understand that I don't believe in seeing my family doctor next month. If I book something now and they're not available till next month, I mean that's specialists like that, that's how specialists are. You're that's how long their wait time is. But to see a family doctor here, like our wait time is the next day. And why is because we have 5 slots on each doctor's schedule for same day booking. So accessing care, somebody calls in 9 o'clock in the morning, urgent appointment, I really don't want to go to the emergency. It's just a quick emergency refill. Um, they're happy at the end of the day, right? And then also we do have walk-in services as well. And again, a lot of our providers here, the way that we have our workflows implemented is if somebody's coming for a quick B12 injections, allergy injections, again, we double book anybody that's calling, we double book those patients. So um, accessing care at this clinic, I mean, we have 14 slots available tomorrow for walk-in. And then each provider that is accepting patients, our family doctors, they have 5 slots available on their schedules for their own patients to book. So accessing care, having an organized workflow, using your template codes in Oscar, again, it does go a long way.
So a related question from one of
Mm,
our attendees, from Jennifer Wan, and she asked, any concerns about patient booking an inappropriate amount of time or wrong appointment type when doing online booking? For example,
great.
concerned that no one is triaging the patient's concern.
So, what I'll do is after this call, if you can just record these questions, I can send Jennifer maybe a screenshot of my appointment types for booking. So, for example, Dr. Sarah, who has recently joined our clinic and is accepting patients, he's a fairly new, he just graduated about a year and a half ago, so he's fairly new. He found that he does 10-minute slots, but he found that when patients are booking using the same appointment type online for mental health, because his mental health appointments was slowing him down. So what I've done is I've added a mental health appointment type in our online booking for them. So if a patient is going to book a mental health appointment, it's a 20-minute slot or 15-minute slot, depending on how long they want those appointments. And again, each appointment type has a different length. So for example, IUD insertion, it's a 20 to 30-minute appointment for Dr. Joy. And that automatically reflects in the Oscar scheduler. So all our appointment types have different lengths, different durations, which again gives that doctor time. And even if they do finish that procedure quicker, they still got 5, 10 minutes to kill, right? Maybe going through notes, doing some indirect time. But yeah, using if you are implementing online booking, make sure you edit your appointment types to the duration of that visit.
Actually, how have your doctors found the patient intake form system? Like, have they customized
Yeah.
those appointment types where they're asking patients to fill in certain information prior to appointment booking? And uh, is it has it reduced the consultation time?
Oh yeah, because for the day before the pandemic, I was opening this one clinic or assisting, helping opening this one clinic, and I had a family doctor accepting new patients. This is before online booking. And again, it was all manual, right? Like they would come in, they would have to handwrite their intake form, their medical history and whatnot. Everything was done manually. And again, some patients would come in a couple minutes late. Some patients were not mindful about arriving 10 minutes prior to fill out that intake form. So, implementing a patient engagement solution in our clinic. So Dr. Sarah, for example, who's a great example at this clinic, he's accepting new patients. And what we've done is in our wait list that we have quite a significant amount of patients. What we've done is we've basically emailed them a meet and greet booking link, which takes the patient on that journey of booking online, which gets them to fill out the patient intake form, all their history, allergies, and whatnot. And that automatically gets inputted into the patient's document section, and the clinic gets notified that there is a pending document that's sitting in there. So then when the patient does come in for their appointment, when they do book, that intake form is automatically filled out. So I'm again all about killing birds with two or one stone, two birds with one stone. So having intake forms, even some of the procedures that we do, there's always paperwork that patients do need to take home, educational stuff that they need to read up on. So we do use our forms. The forms work if it's implemented online prior for them to book. It works that way. I don't have anybody waiting in the waiting room. Everything gets filled out prior to their appointment. And then when they do come in, then that doctor, say the night before, he's taking a look at his next day, all those intake forms are already inputted. So yeah, just being prepared. Preparation is key. And it does really help the doctors out that are accepting new patients.
Thanks, Ashley. Um, I definitely want to leave some time because we only have about 11 minutes left in our short 45
Sure.
session here. But I wanted to ask one more question before to touch upon the Q&A. With success at MD for me, what does what's next for MD for me? What are your next steps? And if you were to open up another clinic, what else would you do differently now having your 10-month experience here?
I I feel like I've been opening up family practices for so many years and having MD for me being my own, I feel like I've implemented something great because again, I'm all about protecting my family doctors. And that's something that I strive in. So, having, local doctors and family doctors wanting to even explore opening their own clinic. They can come here, they can see what we're all about, they can see what we're doing differently here, how we're reducing admin cost and, maybe getting to know the doctors, seeing, what they're doing differently. I want them to be able to mimic that in their own practice or their new practice or bring that to a more traditional family practice. But I feel like what's next for MD for me, I kind of want, I'm thinking, I haven't told this to anyone. I kind of want to open up a radiology facility. That's kind of what I want to do. And I feel like, getting back into healthcare again, working for, all these family doctors, I see the challenge for getting oncology visits, getting radiology appointments for breast ultrasounds, biopsy ultrasounds, all those things. I feel like there's such a significant wait time now that I want to explore opening up kind of like a one-stop shop. And that's opening up a breast ultrasound clinic. But again, that's something that is in the back of my mind. Um, and I think that that's going to be my new venture is getting into radiology.
Well, hopefully this time next year we'll do a part
We'll
three.
do another one.
We'll do a part three where it's you opening up a specialist clinic. I
Yeah.
want to touch upon a couple questions that came through. Christy asked, she asked that do your providers also provide their patients with IMMs? Do you have nursing?
IMMs.
I'm not sure. I apologize.
I
I don't know
think
the
she's
acronym.
asking if we have nurse practitioners or nurses in my clinic.
Possibly.
If that's it, no, I'm waiting on Vancouver Coastal with their new nursing program to dive into that program maybe sometime in the spring of next year. But right now, no, I don't really. There's not a massive need of getting a nurse in at MD for me right now.
I see. Christy, I apologize if I misunderstood your question, but feel free to repost that question in the Q&A.
Oh,
Um,
the clarification is immunizations is what
oh,
she was
okay.
referring to.
Uh, so I was gonna do a webinar on how to prep for a flu clinic. But again, all my doctors, they kind of wanted, with again being in BC, being on the LFP program, doing a simple ejection for fee for service. It never used to be bang for your buck, but now it is. So all my doctors right here interested in doing their own flu shots and immunization.
Great. Thank you, Ashley. A related question, I was just coming up here. And that's actually at the back of my mind as well. With only two MOA staff, do you
Mhm.
have any backup? So if one call in sick or request time off, how would you handle that?
I jump in if needed, but luckily, knock on wood, that's never been the case. I do have a colleague of mine that I've worked with in the past. She's actually a new mom now and she's looking for work. So she always says, "Hey, Ashley, if you never need me for backup, I'm always going to be here." So, um, yeah, I'm not that nervous if they do end up both of them get mono or strep throat or something. I'm not that worried because again, it's super easy and useful to for someone like for myself to hop on and to help. But most importantly, with the power of technology, appointments can easily be converted to phone appointments.
Mhm.
So I've never been concerned that, I mean, Simone was sick on last week and it was just Joe, but still, like, he really didn't need to do much. I had three doctors working remotely and three doctors working in clinic. And the way that it was organized was that I think he did feel overwhelmed in the morning because there's a lot of phone calls coming in. But then again, it eased up within the day. So, but again, he did it, managed it all on his own. So
Once he had some coffee, he probably handled
it's not it's very hard finding staff. Um, but my little secret of hiring staff is I personally don't like, I mean, it's not that I don't. I tend to hire people that are in the hospitality industry. So for example, Joe, he's been a bartender, Simone's worked in restaurants, so they can multitask. And I feel like they make the best MOAs is someone that works in the restaurant industry.
it. That's really
That's my
interesting.
secret. Their customer service is exceptional. Um, like they can do 10 things at once. Um, and most importantly, they're so kind to patients and super helpful when needed with the doc. So it's a
But
little secret that I have.
I think everyone here is going to steal that little secret. Not a
They're gonna
secret.
go to Earl's and they're gonna hire every single hostess.
We'll do a company dinner and sole purpose of
Earl's.
finding the right servers to hire.
Yeah.
There's a question from Taylor. And this is a really interesting question as well. So with you've implemented Cortico, Wave the Weight, and several other technologies and whatnot. Thinking forward, what are some of the top obstacles that continue to stand in the way of your staff and doctors, preventing them from being efficient?
What's standing in their way? Their phones. They're always on their phones. I don't know who they're texting.
Like
Um,
Instagram?
yeah, they're always on social media. They're on Facebook. And I'm like, you got a patient in room one. You don't even, anyways. I mean, it's not just for doctors, like everybody's hooked as, social media and technology. But outside of that, I would say sometimes find that sometimes working after a stat holiday. So for example, BC, there's a stat holiday on Monday. Um, and Tuesday was kind of crazy. I would not crazy in a not in an organized way, but I would say we had quite a few patients looking for walk-in appointments. And again, I'm all about trying. I used to be a yes person. I guess I kind of still am. And for me to turn away a senior over a simple prescription refill, I kind of didn't want to. So, we had to kind of go through the schedule. We had to kind of figure out who can we double book and this and that. But I don't mind those days because I love those days. But I would say sometimes trying to help everyone can get kind of crazy.
Mhm.
But I would say that's only the challenging thing. I feel like a lot of family doctors have to deal with a lot of paperwork, and I'm trying to figure out what I can do to help in that part of their practice is paperwork. There's so much paperwork, medical legals, disability forms, physician attending physician statements, workers' compensation forms, lawyers' documents. I feel like that can really stress a doctor out, but I'm still trying to figure out, and maybe the next time when we do this, I'll have a solution, but I feel like that is what slows doctors down and burns them out is the amount of paperwork. I have implemented a few things, but again, trial and error. We're going to see how it works. If it doesn't, it's going to be something else is going to be implemented. But I would say the amount of paperwork that family doctors have to deal with, that can really, really back up their day.
Mm-hmm.
Yeah.
Just one final question before we run out of time. And then for any of the unanswered questions, we'll definitely be following up individually. So a question from Chris, which is related to faxing, and this might actually be relevant to Ashley, what you're describing with Wave the Wait. And Chris's question was asking how are incoming faxes handled? Like who takes the relevant actions, who assigns it, who does all the faxing? And I think the question really, the context is that if there's only two MOAs and the doctors are kind of looking at, incoming things and they're already executing it, they're, using an instant messenger. With faxes though, who would deal with the failed faxes, for example?
Failed faxes. Oh, do you mean like us being the sender?
Yeah, correct. Like if a busy, wrong number, out of service, like who would be responsible for that?
Okay, so the great thing is, and I don't know what's in Ontario, but the most phenomenal thing in BC is we have a system, a directory called Pathways. Now, Pathways, I mean, I think they could do a better job at updating their information that they have on there. But what I've done is, and this is for anybody that's opening up a new practice, I spent about 2 solid days. I cross-referenced, and so I use Oscar Pro, and the amount of specialists that they already have preloaded on there, they're from like the 1900s. Like their fax numbers are so outdated. There's doctors that are deceased on there. So I had to go in and clean the entire specialist panel that we have for referring, so the consultation section directory that we have. So what I've done is, so for each category, dermatology, gastro, internal medicine, general surgery, what I've done is I went and I removed everybody that doesn't exist anymore, and I synchronized and added, actually manually, I went and added every single specialist. So for example, dermatology, who's the top 10 doctors that we can refer to derm that has a lower wait time? And doing that, again, it's super helpful. It decreases fax fails and all that stuff. But again, we use SR fax at the clinic. And the great thing about SR fax is we get notified. We'll get a pop-up and then, I mean, we do look at it periodically throughout the day, what's been failed. But yeah, we make sure that it's not like a full-time job that an MOA has to do is to, pay attention to faxes. But again, updating your current directory with actual real information and actual real fax numbers, it does go a long way. And again, it takes a bit of time, but it took me like a day and a half approximately. And yeah, like I would say, like I took a look at our failed faxes today at about 3. Usually the pharmacies, like Shoppers Drug Mart, for example, their faxes always fail for some reason. But again, we do monitor it, like again, like every 5 minutes, like not every 5 minutes, but 5 minutes within every other hour. And then we just simply refix it or investigate, find the proper fax number, and then refax it. But again, now with Wave the Wait, all our incoming faxes get synchronized to the correct doctor who the fax is for. And then sometimes the great thing about Wave the Wait is it's not going to send everything to the doctors. It sends things that they want to see. So consults, prescription refills, other requests, appointment notifications, things like that. That gets linked to the chart, but the office assistants get notified, not the doctor. So it is such a cool system, and I hope some people try it out, but it does make a difference if you get like 700 faxes a day, it makes sense to implement it.
Awesome. Thank you, Ashley. We are 3 minutes over time from our 45-minute session. So thank you, Ashley. One final question slash comment. I know that you've hosted several doctors, some organizations as well at MD4Me. And there was a couple questions in the Q&A just trying to drill down more on how some of your operations works. Would there be an opportunity to have that as well for the attendees? And if
Oh,
so,
yeah.
perhaps Matt and I can arrange to have some follow-up conversations.
100%. What I'm going to do is when we do send out a follow-up email, Matt, if you can kindly include my Calendly link. If MOAs, office assistants, doctors, or new companies that are wanting to start new clinics or to even explore what we're doing differently here, you guys are more than welcome to stop by absolutely anytime. From 12 to 1 is when we all have lunch. So another great thing about it is we all eat together. It's very important for us to all have lunch together because that's when we can talk, converse. I mean, if someone's ticking somebody off, again, like it's all open in the air. We're just the one big happy family at the end of the day. And again, when we eat together, you know, we do well together and we're providing a service that's again amazing. And it's so important to me to provide a service like healthcare to our community. But yeah, you guys are anybody more than welcome to pop in anytime. My clinic is located in Vancouver. I'm on Broadway and Arbutus. But yeah, I'll maybe drop my clinic address on here and my cell phone number, and you guys are more than welcome to text me, call me anytime if you guys ever want to pop in.
What we'll do probably to make it easier is that we'll probably send up a follow-up email. I know there were some requests for the recording as well for those who joined late. So perhaps, Ashley, if we include that information in the email, that will make it easier. If it's in chat, it basically gets deleted after this webinar.
Oh, right, right, right.
Yeah. So we're 5 minutes over time. But thank you everyone for attending. And just for any unanswered questions, Matt and I will keep track and follow up. Thank you, everyone. Thanks for attending.
Thanks, guys.